And last but not least, our final speaker is Dr. Mawlana Sami Al-Hashmi, who is a dental surgeon at Bakery Hill Dental, Imam for Point Cook Islamic Council, and Islamic scholar who teaches in Zuhud Academy. He will share with us information on caring for oral health while fasting.
السلام عليكم ورحمة الله وبركاته. الحمد لله والشكر لله والصلاة والسلام على من والاه وآله وصحبه من سلام. By the grace and mercy of Allah, my colleagues here have done a wonderful job in covering, mashallah, a few of the important things to consider. I actually wanted to address a few of the oral health concerns and also things that come up in the regular dental clinic. There are two aspects that I wanted to focus in on for this small amount of time, which is going to be number one, the what to do when faced with certain dental products that we use on a day-to-day basis, and what should our oral health regiment look like as we move forward. And the second is going to be in regards to what do we do if we do get into having to book in dental emergencies, and how many of the dental treatments that we normally do at the dentist, what essentially can we do and can't we do, and what should we do as planned treatment, maybe perhaps after the month of Ramadan. So we'll start off with some objectives. So alhamdulillah wa shukrullah, there is an objective to Ramadan, and that objective is taqwa. Being able to attain taqwa is one of the most important things that is mentioned. There's a verse that I will go through right after this, but perhaps the most, I guess, simple way of defining this is Ramadan is actually a training in which we are not doing something that we would normally do. So, if, for example, eating and drinking during the time of between, say, Fajr and Maghrib is normally allowed, we discipline ourselves by not doing something that we would normally be able to do for a period of time. Now, this actually teaches us discipline in a very practical way, and that is why it is linked to taqwa. Because if we can discipline ourselves, without going to a long discussion, there are actually 7 gates that affect our heart. And it is said that on the day of judgment, if we are able to present to Allah something called the qalbin salim, which is a heart that is pure, then basically we are able to, attain, Jannah without the possibility of any punishment. There are actually 7 gates that lead to the heart, and these 7 gates are the eyes, the ears, the nose, the what we eat, the risk that we put in, and what we use our tongue for, hands, feet, and your private parts. So these are the 7 gates that actually lead, or are the inputs to the heart. So building a relationship with Allah and reading the Quran, of course, is going to be acts of worship that we do. But also in this time period, where there is an aspect of community, there's iftars, there's things that are organized outside of one's house, and we should try and attain that as well. So there are the objectives. This is the verse of the Quran that establishes the Ramadan itself. يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. لعلكم تتقون being you attaining this mindfulness of taqwa. Now, I thought I would just go through the 5 rulings of fiqh very quickly before I launch into the things that you can and can't do, questions about toothpaste and mouthwashes and so on. So as a general thing, if you have 5 fingers, this is going to be very easy to remember. Number 1 is fard. It is obligatory. You don't have the choice of not doing it. Sunnah is something that is recommended to do. Mubah is something that's permissible, kind of like, turning on a light switch or wearing a pair of jeans, as long as they're not too tight fitting. Makruh is something disliked, and haram is unlawful. So at any one time, if you are faced as a clinician with a question, can I get a root canal treatment done? Can I use toothpaste? It's going to fall into one of these 5 categories. Okay, it's either going to be fard, sunnah, mubah, makruh, or haram. And basically, this is what we should have as a basis, just to know that there are rulings for every single human action that we do. And that's just not for, actions that we do in Ramadan. That is in general across our lives. Now, there's 3 types of actions that usually can be done during fasting. The first type is actions that break the fast, and they require you not just to do a qada, which is a make-up fast, but they also require you to do something called kafara. Okay, this is a very serious thing. If you are in this category, you have intentionally broken your fast by either doing something that you weren't supposed to do, like eating and drinking on purpose, engaging in sexual intercourse or so on, or you actually were did something knowingly that will completely break the fast. Now, this is something done on purpose, and this is the only time when we talk about kafara. I will go through kafara in a quick slide, but this is the first type of action. The second type of action, the actions that you can do, is that you break the fast and it requires the qada. Okay, you just need to make up that day of fasting at another time. It could be any time where you feel up to it. Now, some of my colleagues actually went through, times where you are actually exempt from fasting. Say, for example, you had our, hayd, nifas, isti'ada that was mentioned. There was diabetes. Sometimes you actually qualify to not fast in that time period. So that would fall under qadas. And this is actually where a lot of the normal Muslims will engage in certain actions that could need them to make up the fast outside of Ramadan. So basically, I'm not going to go through all of these, but as a rough guide, like for example, if you unintentionally eat or drink something, you mistake the time of Maghrib or Fajr. You swallow more than a pea size. There's something stuck in between your teeth, and you swallow it during the Ramadan fasting. Wudu water, you take in too much of the wudu water while you're taking wudu. You swallow some toothpaste, dental products, you vomit more than a mouthful, and you actually swallow a portion of that vomit. Smoking in general, entering the throat. Basically all of these fall into the category of actions where you only need to make up that fast after Ramadan at an appropriate time. And of course, for those people that have established a chronic illness or disease which prevents them from fasting, when they feel up to it and better. And the third and final type of action is the ones that do not affect the fast at all. Okay, so inshallah, these are the three types, of course, and there are three very important things that I usually like to cover before we launch into the things that you can and cannot do. The first of them is there is a difference between forgetting, mistaking, and sinning. Okay, forgetfulness is when you genuinely forget that, and you have an entire meal. You have food, water, drink, you brush your teeth, whatever it is, and then you remember, oh, I was fasting. It was the month of Ramadan. This requires no action. You can actually just continue to fast as normal without any issue. Mistake is something that you had the knowledge that you're not supposed to do something, and you still unintentionally commit that action. So, for example, you knew that there was a risk that if you had toothpaste, some of that toothpaste could trickle into your throat, and this will require you to do a qada of that fast outside of Ramadan, because that's a mistake from your end. Or if you say, for example, mistake the time when Maghrib is supposed to come in or Fajr is supposed to end, so on, that is considered a mistake, which is a very common form. And the third one is a sin where you intentionally on purpose break your fast. Hopefully, not many of us fall into that category. Now, kafara is pretty serious. Qada is when you make up a fast, whereas kafara is you actually need to fast 60 days in a row, with the exception of when you're menstruating and so on. But this is pretty serious. This is you breaking your fast on purpose. And what I usually mention to people is that there are three criteria that are looked at when you are establishing an excuse. And this is for any excuse, whether it be diabetes, whether it be haid, whether it be isti'ada, whether it be frailty. You need to, and on this slide, it's actually written. Number one is that you need to see a specialist of that field in both the Islamic side, so Islamic scholar, which would be called a mufti, and a specialist, which is a doctor. It can be a non-Muslim as well. Second is the manifest sign that you have, and the third is relevant past experience. These are the three things that on the day of judgment you will actually be asked if you had a shortcoming in your fasting category. Okay, and many people sometimes mistakenly use the excuse of feeding 64 people instead of 60 days of fasting in a row. And I just wanted to clarify that this is not a choice. This is something that only if you fall into the category of not actually fasting, and you've established that excuse and you can no longer recover from that, that's when you would feed 60 people, 2 kgs, half sa'a, or full sa'a, which is 4 kgs. And the other thing I wanted to definitely mention is just like we are connecting ourselves with our patients and Islamic, Muslim-minded and taqwa-fearing doctors, we also need to connect ourselves with scholars. And there is Darul Ifta Australia, which can address all of our concerns in regards to actual formal answers and validating and making sure that on the day of judgment we have at least these people to kind of second the fact that we did not do something that was made fard on us, like Ramadan or so on. Inshallah. Okay, let's move on to the Ramadan oral health schedule. So, what I generally recommend for people is that generally there are 3 times in a Ramadan timetable. First is you're not actually fasting, you're before or after Maghrib time. All of the normal things that you normally do, you can do. So you can brush your teeth, you can use electric brush, you can use water flosses, you can clean in between your teeth. You can do all of those things. So pre-Fajr, when you've had your meal, what you should ideally do is once you finish the meal, you can brush your teeth and then perhaps have a final drink of water. And that is the first thing. The second thing is going to be when you're actually fasting, I do not recommend people to use any kind of oral products, whether it be mouthwash, toothpaste, any kind of flossing or dislodging, things. If you have something stuck in your teeth, generally speaking, if you can just dislodge it and then spit it out, that would be a better way of doing it. However, the ruling is that if it's less than the size of a pea and you actually swallow it, it does not affect your fast. So generally speaking, in the middle of the day, you should be using miswak. And there is a way to do it, but perhaps I can outline it. Generally speaking, when you're using the miswak, you should be cutting it every single day. I did do some research on miswak and its qualities, and it was comparable and even better sometimes to regular toothpaste. So miswak is an amazing thing that we have, but you actually need to cut it, keep it moist, and actually every day you're supposed to be cutting the ends of it. So it actually runs out very quickly. Probably in 10 days, you go through an entire miswak, which is the size of your largest finger. So definitely that is the protocol when you're fasting. Outside, when you've broken your fast, again, you can go back to using all of the products as you normally do. So that would be your oral health schedule. Now, in terms of dealing with things that you do not have too much control over, like emergencies, can I go to the dentist generally? The general ruling here is that it is mubah, which is it's not praiseworthy and it doesn't it's a permissible aspect, or it's sunnah. So if you're in actual pain, you actually have swelling, you have an infection, you are getting headaches because of this, perhaps sinusitis is happening, you have an infection in your upper molar, which is actually spreading to another area. Of course, in all of these scenarios, you would be in the category where you need to seek dental help. You need to go to an emergency dentist or the hospital if they have a dental program. And basically, you need to present and do what you need to. It is very likely that when you're in that appointment, you're probably going to break your fast. It's very, very likely. Even though we have high and low speed suctions, we have all this stuff. The water that is spraying through most dental tools is going to inevitably go down your throat and it's going to break your fast. And most likely, if it's outside of the timing that we're fasting, you're just going to have to address that and make that fast up at a later stage. So very likely that emergencies you need to cover in this way. The routine planned dental treatment, I usually recommend. Please kindly, if it's a planned treatment like a filling or something like that, try not to plan it in Ramadan. Because you don't want to risk for a filling or a cleaning or something simple that you can get done outside of Ramadan, outside of emergencies, to be done in Ramadan, because you are risking the fact that you will break your fast. So that is a simple thing. And of course, there are some websites that I've put on here for further reference and emails. Fatwa.org is actually the official Darul Ifta, where you can actually get answers to questions written. And it is very important to us to have some kind of view on the Day of Judgment, because we should present ourselves very well to Allah subhanahu wa ta'ala. And if we cannot explain our case of not fasting in Ramadan or so on to our colleagues and scholars, then how are we going to present it to Allah, who knows our very thoughts that were going through our heads when we were doing the action? So may Allah subhanahu wa ta'ala make ease. Jazakumullah khair for your time.
Thank you, brother. Jazakallah khair for imparting your much learned Islamic wisdom and very practical advice and aspects to oral health that we may not have actually considered before. So thank you for that. Yes, there was just one question, I think, about brushing teeth before or after, but you did address that and referred to using miswak in between. So that was good.